Let's talk about lupus, rheumatoid arthritis, and collagen. Welcome back to my channel. My name is Sylvia and I'm a carnivore diet coach. This video is inspired by somebody I was talking to just this past weekend, and we were addressing lupus plus rheumatoid arthritis plus leaky gut and all kind of other unpleasant symptoms that come with the combinations of all of these. And I could relate a lot to it because I was dealing myself with the rheumatoid arthritis side of things. And there were a lot of similarities. In fact, a lot of pain, the way that diseases manifest are quite similar, and I would say there is a common denominator to both of these diseases, and that is collagen. For those of you that are new to my channel, a few years ago I was able to reverse rheumatoid arthritis by going on the carnivore diet, and the version of it I did was paleo-ketogenic diet from the clinic in Hungary known as Paleo Medicina. And the diet was basically meat, fat, salt, water, and organ meats, and you had to stay in ketosis over 2. And that really worked for me so quickly. Within 10 days, I was able to notice major improvements to how my joints felt, my pain levels basically reduced by 80%. And then I stayed on the strict PKD for the next 6 months. And then I was able to introduce some other foods, and I was doing for a while PKD maintenance. Then I was on the generic carnivore diet. Then I added some more dairy and fruit when I was pregnant, but mostly I stayed about 80 to 85% meat-based. And yeah, and here we are today. I'm back to being on a carnivore diet with some occasional fruit because I'm still breastfeeding. Before I discovered carnivore diet, I was battling with rheumatoid arthritis for about 5 years, tried all kinds of different remedies, treatments, protocols, and sometimes I would see a temporary relief in the pain levels, but nothing that really worked. Because at first I was treating my joints, trying to address the joint tissue. Sometimes I was just taking painkillers and thinking that somehow rheumatoid arthritis will go away. Then I was trying to go after my immune system, and then finally I focused on my gut, on my leaky gut. I had my gut permeability tested. When I did that, it came back that I had a huge gut permeability, and I started focusing on sealing of my gut, and then rheumatoid arthritis went away. Since then, I am convinced that all autoimmunity originates in your gut. So the first part to resolving lupus rheumatoid arthritis equation is to acknowledge that you have a leaky gut issue and you have to seal your gut wall. Why would you want to do that? Because undigested proteins, fragments of bacteria, toxins can get past your gut wall, travel through your bloodstream, and get and attach to the collagen tissue that is so abundant in your joints and in your connective tissue. And there is something interesting about collagen, that it is this amino acid structure that it has, that it attracts all kinds of toxins and cell wall deficient bacteria. If you have a healthy gut lining, then that cell wall deficient bacteria and their toxins cannot get past the gut. But in the people that have leaky gut, that cell wall deficient bacteria travels around and attaches itself, let's say, to the joint tissue, specifically to the collagen molecules. And there was a doctor about 70 years ago, his name was Dr. Brown, who suspected that it was bacteria that was causing a lot of problems for rheumatoid arthritis patients. So he treated over 10,000 patients with antibiotics, and there were some other recommendations to his protocol, and had a lot of success. Now, he couldn't figure out how that bacteria was getting into the rheumatoid arthritis patient's joints, but he knew it had to do with the bacteria. Well, now we know that it's the leaky gut that allows the bacteria to travel to people's joints. So my understanding of the mechanism for rheumatoid arthritis and lupus looks like this. The toxins and cell wall deficient bacteria get through the increased gut permeability, travels to the joint tissue or the connective tissue. It attaches itself to the collagen molecules, damages them or alters them. It alarms the immune system, which starts looking at it and starts figuring out how I can attack it, and eventually starts building antibodies that are addressing our own collagenous tissue as well, along with the fragment of a bacteria or that toxin. And then this is what gets diagnosed as autoimmunity, because that antibody will have a structure that will attach to the collagen molecule to get rid of that destroyed, damaged, or altered collagen molecule. And we call it either rheumatoid arthritis or lupus, but the conventional medicine calls it as autoimmunity, and a dysfunction of the immune system, and that your immune system is doing something wrong. And I don't think that is the case at all. I think that the immune system is doing what it's supposed to. It's supposed to get rid of altered, damaged, or contaminated tissue. In this case would be joint tissue or connective tissue. Alright, so I have some company for the remainder of the video. If you haven't yet, subscribe if you like this type of content. Share it with anybody that can benefit from it. I also do carnivore diet coaching for anybody that wants to address health issues with the diet. And I love to deal with autoimmunity, SIBO, and all kind of gut dysfunction. And I will see you in my next video. Bye!